I'm not saying removing an infected root canal will cure your back pain and neck pain, but it did for me, for my personal tooth. I'm Dr. Chris, the detox dentist, and today I'm going to talk to you about my story. About 20 years ago, I had a tooth up here, number 14, the first upper left molar, that received a root canal by an endodontist in California shortly after I got out of dental school because I didn't know any better. I had a cavity, a large filling, so of course, root canal, right? Now, fast forward 20 years, I've had back pain, I've had neck pain. I was a gymnast through college, so I expected it to be from that or from my occupation, my profession, looking at the phone all the time, things we all do that we relate to back pain and neck pain. But the reality is, the day I had that tooth removed, okay, the next day, my back pain and my neck pain was gone. Not diminished, gone. Now, this even surprised me because I would have probably should have expected this kind of result, but I didn't. You see, tooth number 14, the one I had removed, has a meridian connection to that specific part of the spine. You can see that right here. I even had to ask ChatGPT to review the evidence. ChatGPT agrees. Neck and back pain. Considering that I also had some stomach challenges that we all did, that also went away and also was related to tooth number 14. Coincidentally, I am sure. Now, I had the tooth removed, took 3 days, IV, extraction, IV. So I'm thinking maybe it was the IV that made me feel so good. Maybe removing the tooth and getting all those healthy IVs took care of the back pain. But you know what? It's been a year and the back pain and neck pain have not returned. I still am a dentist. I still practice 3 days a week. I still do the neck thing. I still have to work like that. That's what we do in dentistry. And I don't feel any back pain. It is literally the best thing I've ever done for myself. Now, I tell my patients this anecdotal information all the time, but they get to decide what they want to do themselves. You see, as a biologic dentist, we don't tell you, don't get a root canal, don't do this, don't do that. We simply want to inform the patient of all the options they have, all of them. That includes removing the root canal, okay? Maybe a retreat, maybe they want to get a root canal, that's up to them. But most of my patients choose to remove the root canal for various reasons. And we have so many amazing anecdotal stories that you're going to hear in this vlog coming up over the next couple of weeks about patients that have had similar experiences. Of course, it's all anecdotal. It's not a research study. It's just observations from patients and from me. I'm going to have some of these patients speak to you themselves so you can hear from the horse's mouth like you just did from me. Now, for me, it was life-changing, and I did not expect as much of a positive result as I got. So if you're suffering from migraines, back pain, fatigue, chronic inflammation, autoimmune diseases, Hashimoto's, the things that doctors love to label, and they have not looked in your mouth with a true CBCT scan to look for infections, I would say take all their advice with a grain of salt, see a biologic dentist, get a true evaluation, and let's see what's really going on. Watch the entire video of my extraction. I'm trying to link it below in this video, and you can see my journey. It's a little bit longer, and it's purely raw video. It's pretty funny, actually, but it may be worth watching. Every week, I'll release a video on Saturday that's going to talk about a case or something biologic, and we're going to do a live once a week on Thursdays. I don't know when yet, so subscribe, click the notifications button so you don't miss these lives because you can ask questions about your case. No medical advice, but we can discuss generalizations about what you're talking about. Hopefully that will help.